organisation. So most of today's agenda will therefore be focused on the governance documents and arrangements that we're required to approve in order to become established. And the effective structures and good governance must be in place to allow us to deal with the issues that really matter to the people who rely on NHS services. But we will be meeting again on the 20th of July. And at that point, we can have a much more detailed discussion to focus on what our plans are, how we're going to go about setting them, the priorities, and how we're going to achieve them. But I'd like to start with today just by paying tribute to all of our NHS colleagues across and our care staff, volunteers and carers who've worked so hard and tirelessly over the course of the pandemic. The pressures we know have been for many and remain relentless, and the care and compassion have been the hallmark of everything you do. So thank you very much. And I'd also like to take the opportunity to thank the staff and governing body of the CCG for their dedicated work over almost a decade and for their very thoughtful and constructive approach to transitioning to our new integrated care board within an integrated care system. But we've been talking about integration for years, the joining up of services, and that's for as long as I can remember. But that's too often had to happen despite the system. It's felt a bit like trailing through Dartmoor in the mud with a headwind and a heavy rain. And the purpose of these reforms is to put wind in the sails for the teams that are trying to join up services, and to keep in mind that that's not to make this easier for our system, but to make it easier for the people who rely on our services, and until we can really make a difference to tackling the inequalities that they face in outcomes, access and experience. But on the downside, I'm afraid there's a whole Scrabble board of new acronyms to deal with: ICB, ICS, ICP. And I think the trouble is that these acronyms mean nothing to anyone. But the letters that really do connect with people are the letters NHS, and that's because people really care about the values and principles that underline the National Health Service. So we decided to keep this simple, and instead of calling ourselves an integrated care board, we're simply going to call ourselves NHS Devon, because that's what we're about, holding the majority of the budget for NHS services across the whole of the geography of Devon. And we want you to hold us to those principles and values as we move forward. But we know that the NHS can't do this in isolation. We know that we need to be working with our partners across a wider system if we're really going to make a difference, and particularly in tackling all of the upstream prevention and work to tackle inequalities. So that we're going to be doing that now as part of one Devon system. And within that, we're going to be working with the One Devon Partnership. You may hear that referred to in places as an integrated care partnership, but we want to call it the One Devon Partnership. And that's the place where we'll be working alongside so many of our other partners across the voluntary, community enterprise and social enterprise sector. And we'll be working as well with colleagues from local authorities, from our research institutions, education, housing, and all of our other partners, so that we can really start to tackle and make a difference at local level, as well as at our system, and making a difference in the places that people really notice that happening. So what I'd like to do as well is just talk a bit about our board. And to do that, and to demonstrate how different it is, and how many more people and how much more diversity that we represent, I'm going to ask everyone to just go around and introduce themselves, and a little bit about themselves and what motivated them to join the board. I'd like to start with Jane, our Chief Executive.
Okay, thank you, Chair. So I'm Jane Milligan, and I am the Chief Executive of NHS Devon. Certainly, as I think you mentioned, we've been working on integration for many years, and certainly I've been working for integration for as long as I've worked in the NHS, which is over 30 years, as both a clinician, a commissioner, a chief executive of providing organisations, and I came to Devon to undertake the role as the accountable officer of the CCG, but with an eye to taking this role as the chief exec of NHS Devon. So I am over a year in my role, and absolutely very pleased to be here. So thank you.
Back to you. Thank you very much. And so I'm Sarah Wollaston. I'm a GP by background. I was also involved with GP training and as an examiner for the Royal College of General Practitioners. I also worked for a while as a forensic medical examiner, seeing mostly women who had been victims of sexual assault. And in addition to that, I then took a step into politics. I was the MP for Totnes from 2010 to 2019, and during that time chaired the cross-party Health and Social Care Select Committee and the liaison committee of all the select committee chairs. And then after leaving Parliament, I've decided to return to clinical practice, so became the world's oldest medical student for a while, resat my professional exams and roll my sleeves up to help colleagues and refresh my clinical practice. And now absolutely delighted to be able to bring all of those worlds together and really feel motivated to make a difference, to actually be held to account for what looks different for people who use our services. So Sheena.
Hello, my name is Sheena Asthana and I'm the non-executive director with a particular remit for population health management, health inequalities and digital transformation. I'm a quite ageing academic with a very broad portfolio. I am the director of the Plymouth Institute of Health and Care Research, and I also co-direct Plymouth Centre for Coastal Communities. So my research portfolio includes health inequalities, evidence-based public health. I wrote a huge book on health inequalities through the life course and the sort of interventions that might work at different parts of the life. I also specialise in resource allocation, which makes most people very, very bored because it's quite techy. But this is about how the NHS resources are distributed around the system. And indeed, I sit on the Advisory Committee for Resource Allocation, which is the independent body that advises on that distribution. I've also had a very, very long-standing interest in rural health and health inequalities, and more recently coastal. I've sat on a number of boards, not just ACRA, but I sat on NICE with the public health remit, Royal Society for Public Health. I sit on a large charity called Change Grow Live, which is concerned about substance use and very complex needs. And I like sitting on boards because most of my research is very applied. I do it because I want to make a difference. And this is just another way of really trying to shape things to make things better, particularly in my own community, Devon, where I am concerned about resource allocation. I'm incredibly concerned about hidden but increasingly manifest health inequalities. And I'm also concerned about our need to level up our digital infrastructure, because I do feel I'm worried that that's actually exacerbating some of the health inequalities that coastal peripheral regions such as ours are experiencing. Thank you.
Graham.
Thank you. So I'm Graham Clark. I'm the appointed chair of Audit Risk Committee. I think I've come to that role through a somewhat atypical route in that, of course, I'm financially qualified. I work for Deloitte, one of the big four firms. But my career has been in a number of sectors within healthcare and a number of roles. I've run strategy for duty healthcare. And business development for them as well. I've done transformation work. I've done a lot of planning, a lot of R&D management. I've also been the chief executive of a Cambridge University spin-out, an immunology business, which I ran for 10 years. And about 10 years ago, decided I would change tack and started doing non-executive roles and trustee roles. I'm still the independent member for National Mind, mental health charity, still a member of the Institute for Cancer Research. I've been the chair of the provider of 111 and urgent care services for 5 counties, 5 million people for 6 years. I've been the audit risk chair for the NHS Health Research Authority, a board member there. That, as you probably know, governs R&D, patient confidentiality and ethics. And from that, I actually was appointed to the Department of Health and Social Care as a non-exec member. And I sit on its audit and risk committee, as well as undertake various other governance activities for them. Actually, when I joined it, on the risk register sat pandemic as a medium to low risk. As it turned out, 6 months later, it was all COVID. So my life had been dominated around governance of the battle plan, about PCR testing, about task force work. But it did actually enable me to take an opportunity to relocate back to the southwest. I'm from Totnes, my family from Totnes, my wife's Cornish. We've got 2 boys here, 3 grandchildren here. So when the opportunity came up to join this board, I was very, very keen to apply, delighted to be here. I'm very passionate about this being an opportunity that we must seize to really drive improvement for the patient and community that we serve. Thank you.
Thank you. I am Tandy Hara. I am on the ICB or the board as the representative for community engagement, and I will chair the People and Culture Committee. My own background is in public health and epidemiology, but I've lived in Plymouth since 2005. And in that period, I actually have worked across the Southwest, including Cornwall, working on strategic issues like inclusion, as well as connecting research with communities. So my own interest is really trying to make sure that what we do in science, in health, actually makes a difference on the ground. I'm very passionate about Devon, and I want to make a contribution to changing the narrative about what Devon is. I think that out there, the story of what Devon is, including the health and how we work and how happy we are as a community, is just not being told enough. And I think I want to make a contribution to making sure that we have a better narrative. So for me, this is about, so what? We're here. Why are we here? And I think it's about changing the community and making sure that we're healthier and happier. Thank you.
Hi, I'm Judy Hargaden. I'm the Independent Non-Executive Director for Primary Care, and I also chair the PENARC Management Board, which is a group that brings together research activities in the universities and service provision across the whole of our system. I have an over 40-year career in healthcare management and some on the front line volunteering after that. I was the chief exec of a provider and of a health authority, and then I became very engaged in change management, bringing together my workforce interests and my general management interests. So I worked as part of the NHS Modernisation Agency, leading all the national workforce change, the Changing Workforce Programme, all the new roles, and other things like Working Time Directive. My last job was applying those skills to the national programme to change school food in England after Jamie Oliver did his television programmes. My motivation to be here is that I think this is just such a wonderful opportunity to go back to collaboration, to making things work together after some years where competition has proved itself to be the very devil when it comes to healthcare.
Good afternoon. My name is Hisham Khalil. I'm an independent non-executive director with a portfolio and chair of the Quality and Performance Committee. My background is that I'm an ear, nose and throat consultant in Plymouth with a subspecialist interest in rhinology, skull-base surgery and sinonasal cancer. My other work is in the University of Plymouth. I'm a professor of ENT surgery and clinical education, and I've done quite a few jobs in the medical school. The last ones were Associate Dean for Strategy, the Dean of the old Faculty of Medicine and Dentistry, until yesterday, the head of the Peninsula Medical School. I have a great interest in new models of healthcare delivery and in quality through my work with regulators like the General Medical Council and the Medical Council of Ireland. And I'm also interested in workforce training. My great motivation to join the NHS Devon family is I really think it's a paradigm shift in the way we should think about health and social care. And I hope that I would make a useful contribution with colleagues for the population we serve. Thank you.
everyone. I'm Kevin Orford, and I've been appointed as the non-executive member for finance, and I'll be chairing the finance committee and the remuneration and internal reports committee. My background is largely NHS. I've held finance director and chief executive posts in the NHS over a period of nearly 20 years. But since retiring from the NHS, I've held non-executive director posts at a CCG in the Midlands, and since relocating here to the southwest, I've been a non-executive director on the boards of the Northern Devon Healthcare Trust, and also on Royal Devon and Exeter, the trust both merged obviously since April to the new Royal Devon Foundation Trust. I've also held charity trustee roles in areas that I'm particularly interested in, for example, in the health and well-being of our refugee communities, and also in end-of-life care. And I was also a board member of Stonewall Equality during the Equal Marriage campaign. So I'm hoping that I can bring all of that experience to the new NHS Devon board. And what motivated me to join the board, I mean, like others, I think the move to system working across Devon health and social care is just such a huge opportunity for us to impact positively on our population, an opportunity to think in new ways about health equity, and all of that against a backdrop of potentially significant new investment in the NHS estate and in digital records that I hope will be happening over the next few years. And I do think, in all of my years on NHS boards, this particular time is probably, for me, the most interesting, exciting point of all of those years, and I'm really pleased to be here.
Good afternoon, everyone. My name is Steve Brown. To give my full title, I'm Director of Public Health, Communities and Prosperity, which means for Devon County Council, I head up not only the public health team, but also communities, which covers refugees, libraries, and our comms and engagement team, and our economy, enterprise and skills team. But today representing the three directors of public health, so we work very collaboratively, Plymouth and Torbay, so Lincoln and Ruth and myself. I'm here representing them. I've had over 27 years, I think, working within public health, sitting on numerous boards, mostly in the NHS back in the PCG and PCT days. My passion and commitment is never waning in terms of making sure, and as well as having lots of good conversations about treatment and about pathways for patients, we also have equal conversations about trying to address the conditions in which people find themselves living in, which got them to the point of sitting in front of a clinician often. So inequalities is going to be key for me. I hope to bring my relationships and the wider portfolio I do hold, I think will be key to enable us to open some doors maybe and create some new relationships on top of the old ones we already have. So I'm very excited to be here.
Hello, my name's Liz Davenport. I'm here as the NHS provider representative. I'm the Chief Executive of Torbay and South Devon Foundation Trust. But I've worked in the NHS for what feels a long time, about 39 years. I started off as an occupational therapist, working in mental health services, being involved in a lot of the transformation around mental health services at the time at which we focused more on how we supported people in our communities. And I've always been really passionate about change as a consequence of that. I've worked in mental health predominantly, but I've also had experience working in acute and community services. And latterly had roles in as a director, senior leader in workforce and workforce development, as well as in operations before taking on a chief exec role. Why did I want to be part of this board? I've been working in the NHS for a long time and seen the real value of working together and what benefits of working together can do in supporting the health and well-being of the people in our communities. Over recent years, we haven't been able to use the opportunity to work collaboratively as much as I would like. And I think there's some real opportunities in the bringing together of organisations to think about how we can transform services for the future and really deliver the services for our communities that we can be proud of.
Hello everybody, I'm Tracy Lee. I'm the Chief Executive for Plymouth City Council, but I'm the Local Authority Partner Member on this board and bring that knowledge and expertise of over 30 years in working in local government, 13 years as a chief executive both here and in Wales, which run a very different system in terms of integrated health boards. I'm also the regional lead for migration, and I'm the senior responsible owner for a joint committee that runs across the heart of the South West, and also the SRO for the devolution deal for Devon. So my passion here is about providing better services and making sure that we address inequalities, and the more we can work together and integrate to do that and not give people the runaround from one organisation to the other, then from my point of view, that's happy days.
I am Sarah Glover. I'm the partner member for mental health. I've come to this role partly due to my lived experience, supporting my daughter through the mental health system for a number of years. And interestingly, she's now working with CAMS as well to support them in the work that they're doing. So lived experience led me to set up an organisation called Parental Minds, of which I'm the CEO. And we support the caregivers. So whether you're a parent, whether you're a friend or a relative supporting a child or an adult of any age, we support you to support them. And that's involved an awful lot of networking, run our own mental health network, and a lot of co-production work. So I currently lecture at Exeter University for part of their peer support training, and we're currently working with the CAMS crisis team on their new pathway and the new eating disorders team as well with CAMS. I've been asked to speak quite publicly for a number of organisations about the work that we've achieved and the way we've done it with co-production with the voluntary sector and the statutory authority. And we've most recently launched a perinatal service as part of our prevention work strategy to support all new parents with those skills that I wish I'd had at the time that I needed them. So yeah, that's what's brought me where I am today. I'm really passionate about mental health. I'm extremely passionate about co-production and the person-centred approach, but not just the person, their family and their network, support network around them, and that real holistic support approach. So I'm really hopeful about what's happening in Devon at the moment, and I believe there's a real thirst for change, so that's why I'm here.
Hello everybody, I'm Frank Kelly. I'm a GP based in Tiverton. I'm here as the primary care partner member, and for me, with my background, that means I'm here for people. And the people I'm here for are all the people of Devon and the staff of the NHS and social care. And I do that through the lens of primary care partners. So it's GPs, primary care networks, dentists, optometrists and pharmacists. My professional background, I'm a doctor, been qualified 35 years, been in Devon 27 of them. Started with a career in the Navy, based at Stonehouse, doing my accident emergency behind Union Street. I've worked at Freedom Fields in the past. I left the Navy, did a GP scheme, did quite a lot of anaesthetics, came back, was an anaesthetic registrar in Plymouth, anaesthetic registrar in Exeter, and then moved to Tiverton. My time as a GP in Tiverton has been pretty varied. I did 3 lists of anaesthetics in an isolated community hospital for 11 years. I've spent 20 years working on the wards. I spent 20 years working in the urgent care centre. I was a GP in emergency and unscheduled care for about 6 years of that. I've done leadership courses. I've been part of the faculty of the RCGP leadership course, and about 2013, I ended up back in the practice doing full-time general practice. So I have been at the coalface doing 10 sessions a week as a fossil in general practice for the last 8 years. I really do understand the system at the coalface and how it works. What is different now, though, is this particular change means that we can do something. So in terms of why am I here, there's probably 3 reasons. One is the leadership that's in place on this board. 2, the fact that we are working in a completely different framework with completely different objectives. I've seen 6 different changes in structure above me since 1999 when I arrived in Tiverton. and none of them have talked, well, I've talked about cooperation, but the framework is not in place to do that. But my main motivator is lessons from my children. They're now adults, 21 to age 30. They're all adopted. I have significant personal experience of what that means. I have two of them with learning difficulties who I've had to try and help through the system. One of them, sadly, has a significant drug problem. So I have seen how the system works for the most needy in our society. So I'm absolutely passionate about health inequalities and what that means for the future. My son has given me consent to talk about him, and both for him and to bring about change in the system. 2 weeks ago, he was on ITU in Derriford, and he's now in the Cedars. What I want people to focus on is the issues about the disparity between physical health and how quickly we deal with it, and mental health. He had to have a physical health problem in order to get his mental health issues dealt with as urgent. And I am absolutely passionate about representing the people of Devon, but I'm most passionate about going for the biopsychosocially disadvantaged, because I think that's what the ICS is about, and I'm sure that with the people here in this room we can do that.
Thanks. My name is Nigel Atchison. I'm the Chief Medical Officer for NHS Devon. So my background, I was a gynecological oncologist. I moved down here in 2004. I was a consultant at both the Royal Devon and Exeter Hospital and Torbay hospitals, and before moving in 2013 to be the Regional Medical Director for NHS England for 5.5 years, before then moving to the Care Quality Commission as Deputy Chief Inspector of Hospitals from the end of 2018 until when I started this role. The areas of expertise and interest that I have over the years are patient safety, patient involvement as partners in their care, co-design of care. I've been a trustee and I'm now patron of the Force Cancer Charity in Exeter, and that passion for patient and public co-design of services, treating people as genuine partners in their care, what matters to them, is one of the reasons why I'm so proud to be sitting here today.
Thanks, Nigel. Good afternoon. I'm Darren Alcorn. I'm the Chief Nursing Officer. 30 years background in nursing in varying roles, mainly in acute and community settings, and then in the last 9 years I've been on board level roles. A real mix of nursing and a variety of workforce roles in there as well, so a slight change in my career path. We're very proud and very honoured to be back in the CNO role. Over that particular time, I think some of the challenges that I've seen have been very much around the challenges within the acute community sector and mental health, working collaboratively, and really very much like Jane said, I joined the CCG back in September 2021 in the midst of the pandemic, with one eye joining the CCG, but in one eye to join that system role, to look at co-production, collaboration, those elements. And I think during those last 18 months, I've been really privileged to be part of the vaccination programme and the Nightingale Hospital in terms of the delivery of that, very centred around individual population with a common purpose. And I think for me that sets a really good foundation of what we can achieve if we work collaboratively with a common purpose and a common goal.
Hi everybody, I'm John Dowell. I'm the interim Chief Finance Officer. I've been working in finance in the NHS for more years than I can remember, but those 30 odd and 20 odd of those have been within Devon. So when I come to work, there are 40 other people like me in the country. And despite my ongoing liking for competitive sport, there's no other dimension of my life where I can say I'm in the top 41 in the country. I'm also responsible for £2.4 billion, which is the budget that we have at our disposal within NHS Devon. And again, there is no other aspect of my life where I can say I'm responsible for £2.4 billion. So in that context, and how money works in the NHS, I think it is true that money is not a solution to a number of problems that we face, but it can absolutely be a barrier to those. and it is a constraint. It's just a fact that we have to live within what we have available. So within my role, I have great power, but of course, as we all know, with great power comes great responsibility. And as long as that responsibility sits with me, I will, with gusto, as I tend to do, but also with a smile on my face, which I hope you've got from this introduction.
Over to Andrew.
Thank you, John, and good afternoon, everyone. My name is Andrew Millward. I'm Chief Officer for Communications and Corporate Affairs for NHS Devon. And apologies, I'm not with you this afternoon, but we have COVID in our family, which I guess highlights for all of us that it's still very much around and very much a challenge for our colleagues in the health service and in the care service. I've worked for the NHS for 22 years prior to a career in Whitehall. And I've been in Devon for the last 4. And I'm really excited by the formation of this new system, because I'm hoping that we can move Devon away from being one of the challenged health systems, which it very much is at the moment, to one that's thriving and doing a really good job. Because I think when we do that, we will then truly make sure that the people of Devon get really good care, really good services. So I'm really hopeful for that, and thank you for the opportunity to say something.
Well, thank you very much, everyone here today. And also, can I just record apologies from Simon Tapley and Paul Renshaw, but also from Kate Shields, who's the Chief Executive in Cornwall and Isles of Scilly, because she's obviously launching her own board today, but hope to welcome all of them to future boards. Now, at this point, I'd just like to hand over to Nigel Edgson.
Thank you very much indeed, Chair and colleagues. At this point, I just want to give a slight overview of some of the key areas that in Devon in terms of healthcare and some of the opportunities, so some of the challenges, some of the opportunities. But I'd like to start, if I may, by reiterating what the Chair said earlier on about the workforce that we have here across Devon and the way that they have stood up and acted on behalf of us all during the pandemic and continue to do so. It's been an extraordinary display of collaborative working, absolute commitment and dedication to providing services for us. And I think what Andrew has just said, unfortunately, the pandemic has not yet gone away. And I think that the first thing that I'd like to say is that we are obviously keeping a very close eye on how the COVID situation is across Devon and are ready to respond, obviously, to that. I think, again, as Darren has said, one of the things that I'd like to point out is that the response that he and colleagues made in terms of the vaccination programme and the way that they reached out to all parts of our community to be so successful in the vaccine programme itself is an illustration of how I think that collaboration that you've heard so much from colleagues around the board here today, it's the way I think that we want to take things forward. Turning to a couple of the significant challenges that we in the executive team and beyond are very aware of and trying to manage efficiently at the moment are the urgent and emergency care pressures, which manifest themselves most obviously through high emergency department attendances and also some ambulance service pressures which have been in the media. We have an urgent and emergency care programme which looks across all partners, all parts of the pathways for patients, right from their homes to support they can get in a community setting close to home, up to and including obviously the hospital setting, and then again supported discharge back into a community setting. And all of those elements we are working very hard on to try and make sure that the pressures that, as I say, are most manifestly obvious at the front door of emergency departments can be eased as soon as possible. The other area that we are putting a lot of time, attention and focus on, quite rightly, is the elective care backlog, which again has been widely trailed in the media, and which has arisen for obvious reasons because of the interruptions to normal NHS working during the course of the pandemic. What that means is that there are a large number of people in Devon who are now waiting a very long time for their routine treatment, and we are working very, very hard to make sure that those people are able to receive that treatment as soon as possible by working not just across our own system here in Devon, but looking at innovative ways of working with partner organisations outside our system in order to be able to meet the needs of people who are waiting for treatment. On the opportunity side, it's a real privilege to be working back in the Devon system again. We are blessed in Devon with a hugely impressive, experienced and committed workforce. And one of the opportunities we have is to build and support that workforce in terms of the leadership that we require internally, try and attract new colleagues into Devon and make sure that we've got a workforce that is absolutely ready to meet the needs of our population as we move forward. And in support of that, we're also blessed in this part of the world with our colleagues in the fields of innovation, research and quality improvement. And we're working with colleagues in the universities, in the Southwest Academic Health Science Network, both to help support and identify good examples of care that we can share and spread more as rapidly as possible, but also to innovate and support research, which again will help us with our learning over coming years. And the other piece that I'd like to highlight, which is a huge opportunity that we've got colleagues with great experience who are helping take this forward for us, is around the digital and data agenda, which we believe is one of the fundamental underpinnings for supporting the work in urgent and emergency care and elective care in terms of driving up the quality of information and therefore the support that we can give colleagues and individuals in Devon to access the highest quality care. We'll obviously report back on the plans that we have related to the long-term plan, which is in place, the oversight framework that we're part of here in Devon, and indeed, of course, our own Devon plan and the strategy which will be presented and draft towards the end of the year. So, Chair, that's just a brief oversight of some of the challenges that we know we face and that we are absolutely managing, and also some of the opportunities I think we have in Devon.
Well, thank you very much, Nigel. I'd just like to move on to the next item on the agenda, which is our declarations of interest, because, of course, it's extremely important that the board holds itself to the highest standards of behaviour in public life. And one of the ways that we do this is by being very transparent on any roles or interests that members have, which may influence how they make decisions. So we keep a record of those interests, and the register will be produced for every one of our meetings. And I'd just like colleagues here today to confirm that the attached register that is on our website correctly records their conflicts or potential conflicts of interest. Yeah. Happy with that? Would anyone like to make a comment today on any specific conflicts or potential conflicts that may arise? Tracy.
Chair, thank you. I did submit to say that I was the Chief Executive for Plymouth City Council, so that does need to be recorded. Unfortunately, it didn't get into it.
Yes, we'll make sure that that's there. Thank you very much.
Yes, it's just a timing issue. Just to say that as of midnight last night, I'm no longer a non-executive director on the Royal Devon Trust. So it's just a timing thing. Just that now needs to be removed from the declaration of interest.
Thank you very much. And Julie, could I ask whether that will then be taken forward so it's accurately recorded? Does anyone else want to make any additions?
I don't. I was only appointed on Monday, so I don't think my declaration of interest have got on the register yet. I have sent them in. One thing people need to know is I work for a private company called Steer Education Exec Clinical Lead 1 day a week. There's nothing relevant on me. That's the only thing I do outside the NHS.
Thank you very much. We'll make sure that that is properly updated. So just moving on to the next item on the agenda, we're going to come to the Constitution. So as I say, this will now be a rather technical part of the meeting, but every integrated care board, or NHS Devon as we're calling ourselves, is required to have a constitution that sets out how it will operate. And that constitution has to be in line with legal requirements set out in the Health and Social Care Act and supporting guidance and the regulations published by NHS England. And so the constitution was approved on 7th of June. And we're asked to receive that constitution. So could I ask, do any members here present have any comments or questions that they'd like to make on that? So could I ask you all to confirm that you're happy to receive that constitution? Great, thank you. I'm now going to come on to John Dowell and the scheme of reservation and delegation. Thank you, John.
Thank you, Chair. So on page 57 of the pack, just sets out in the executive summary what the scheme of reservation and delegation is about. It's effectively an enabling document which sets out the decisions which are capable of being delegated to committees, subcommittees and to individuals, and also those that are reserved to the board. I'm certainly not going to go through the document, but it is a relatively standard set of provisions that we are adopting here. So I'm recommending that the board review and approve the scheme of reservation and delegation.
Thank you. So does anyone have any queries or comments on the scheme of reservation or delegation? Can all members confirm that they're happy to approve it? That's great. So I'm going to come on now to Jim. Thank you very much, John.
We have presented in this pack a number of terms of reference of the committees which have been set up to support the running of the organisation. So on page 94 in your pack, you have a functions and decisions map which sets out where functions and decisions sit within the system and the ICB as part of that. And then on the following page, on page 95, the overall committee structure, which sets out the both the assurance committees and the delivery structure feeding into the executive committee. Following on from that, we have a number of terms of reference of those committees which feed directly into the ICB board. And if I'll run through those one by one and just check whether there are any questions. So on page 96, we have the terms of reference for the Audit and Risk Committee. Were there any issues that anyone wanted to raise with that? On page 109, the Remuneration and Internal ICB Workforce Committee. On page 117, the Primary Care Commissioning Transition Committee. 127 is the Quality and Performance Committee. On page 134 is the Finance Committee. On page 143, the People and Culture Committee. On page 147, the terms of reference for the Senior Executive Team. And on page 152, the ICS Executive Committee. On page 156, the LCP Oversight Committee. And on page 161, the Clinical and Professional Cabinet.
Chair, I wondered, for the sake of anybody watching this committee, if we should explain that it is not a lack of interest or concern that means there are no comments, but it's actually to do with the detailed work and consultation that has gone on in advance. With all due recognition to Ginny for everything she has done on this, it's amazing. But so all of us have had a chance as these have been developed. It's not a sort of, oh yes, just pass it. And my understanding, I would just like to check, is that all of these can be open to review as we discover how it works best, can't they?
Thank you. I'm very grateful to you for Judy for staying on and providing a lot of the organisational memory, if you like, of what the clinical commissioning group. And whilst yours is actually noted to be a transition committee, I think that we very much hope that we will continue to have recognition of wider primary care as we move forward. And we are expecting that this will be open to review, as you say, as we move forward. So thank you for those comments. Right. Okay, back to you, Jim. On page 89 of your packs, we have a list of the proposed chairs for each of those committees, for the assurance committees, and I'll just quickly run through those for the sake of the minutes. So Graham Clark to chair the Audit and Risk Committee, Kevin Orford to chair the Remuneration and Internal ICB Workforce Committee, Kevin Orford to chair the Finance Committee, Professor Hisham Saleh Khalil to chair the Quality and Performance Committee,
Dr. Tandy Hara to chair the People and Culture Committee, and Judy Hardigan to chair the Primary Care Commissioning and Transition Committee. So just ask for your approval for those roles. And the final part of this section on page 90 of your pack. We have a list of, there are a number of specific roles which we are required to appoint to, which are roles held by members of the board. And I'll quickly run through those just for the sake of the minutes. So the Vice Chair, Hisham Khalil, the Clock Guardian is responsible for making sure that we manage patient records appropriately, Darren Alcorn. The Senior Information Risk Owner, so oversight of our information governance arrangements, Andrew Millwood. Our Freedom to Speak Up Guardian, Kevin Orford. Our Accountable Emergency Officer, Darren Alcorn. Conflicts of Interest Guardian, Graham Clark. Health and Safety Accountable Officer, Andrew Millwood. Our Security Director, Andrew Millwood. Our Director of Infection Prevention and Control, Darren Alcorn. And our non-executive member with responsibility for emergency preparedness planning and resilience, Graham Clark. And again, ask for your approval for those posts.
That's great, thank you very much, Ginny. And now we're coming on to the item on the agenda about the Integrated Care Partnership founder member. So each ICB, Integrated Care Board, or in our case NHS Devon, is and each of the local authorities being asked to nominate a founder member for the Integrated Care Partnership. Now, we've decided locally that that's going to be known as the One Devon Partnership. Again, we're trying to get away from three-letter acronyms in everything that we're doing in future and make it understandable to people. So our One Devon Partnership is where all of our partner organisations, including the NHS, are going to come together. It's going to write the integrated care strategy, but it's really going to be a driving force behind making sure that all of us are being held to account for making it happen when it comes to joining up organisations for the benefit of our populations and making a difference on improving health inequalities and public health and well-being. So we have decided that our initial founding member should be Jane Milligan. So we're nominating her and seeking the board's approval for that. That's great. Thank you very much, Jane, for agreeing to that. So, yes,
no, right.
Yes, don't say no now.
No, very happy to be
right. Okay. So where are we coming on to now? So I think we're now coming back to you, John.
Thank you. So item 7, page 168 of the pack, just at the foot, sort of sets out in the executive summary the purpose of standing financial instructions. I'm sure board members will be aware, but broadly speaking, the framework by which we will manage our financial affairs and sets out some key responsibilities, particularly for the Chief Finance Officer. In due course, our internal audit function will be running some tests to make sure that we are indeed running our affairs in line with the standing financial instructions, and we'll be providing that through to audit committee as a point of assurance. But at this stage, the request of the board is to approve the standing financial instructions as set out in the pack.
Thank you. So there are no comments or questions on that, and then we move forward on to the next item is for you as well, John, on the standards of business conduct policy.
Yes, thank you, Chair. So again, my introduction will be brief. We're on, I think, page 198 of the pack. Yeah, so page 198 of the pack, again, in the executive summary, just setting out what the standards of business conduct policy is there to achieve. So it describes the public service values which underpin the work of the NHS, and reflects the current guidance and best practice which applies to all individuals within the NHS Devon that we expect them to adhere to as they go about general business of NHS Devon. Again, the details are set out within the paper, but the request of the board today is to approve the policy for adoption.
Do I have everyone's approval? Any questions that anyone would like to raise? No, thank you very much for that. I'm now going to hand over to you, Jane, for the next item on the agenda, which is around the approval of key policies.
Great, thank you, Chair. So page 228, there are 7 policies that need to be approved. Risk management policy, health and safety, emergency planning, resilience and response framework, safeguarding policies for both adults and children, information governance framework, our counter-fraud, bribery and corruption policy, and also our confidentiality and data protection impact assessment policy. These all got review dates, which we will obviously complete after today as part of the signing off. And just to reassure board members that they have all gone through a process as part of our transition, but actually following our policy and procedure and framework, which is particularly working with colleagues across the organisations to ensure we've got sign-off by the board. So and just say thank you again to Ginny and team for putting all of this together. Tracy.
Could I just ask a question? Clearly, as a new organisation, but in terms of having a lot of people transferring into the organisation, I suppose it's just assurance about training for those that are going to be using these policies. There's a lot of policies in one go, and just some assurance about how awareness is going to be raised.
I mean, Andrew might want to come in, but to some extent, through our induction process, but actually also through the appraisal process, where it's relevant to the people to undergo refresher, it's part of that. And particularly, obviously, safeguarding is a good example of that. So, and as you say, it's to some extent based a lot on previous policies, but obviously recognising the tools for that. Yeah. Andrew, is there anything to add, or Ginny?
I think Jane, you've mentioned most of it, but we do actively monitor staff adherence to all of our policies, Tracy. So these will be the same. Some of these will obviously carry over from the previous organisation. So we have an active programme of training and of monitoring, just to make sure that people are going through the adequate training and have got the right qualifications and other things that they need to obviously go through.
Ginny, did you have anything that you wanted to add?
I was just going to very quickly add that part of the policy and procedure framework that Jane mentioned, this part of the sign-off process is very, very clear on how people will be made aware of the changes to the policy and how it will be publicised and how the training will be done. So that's part of that check-off process.
Thank you. Thank you. Well, so we're now coming on to the... Oh, I beg your pardon. Sorry.
I just want to ask a question about the risk management policy, actually, Jane, which just seems to be a more dynamic policy than some of the others, and particularly the risk appetite appendix, which I felt, perhaps at some point soon needs more kind of active involvement of the board collectively in looking at that, given the changes from the operating framework and so on. And I just wondered if we've got a time scale for reviewing that.
I'm not sure we have, although I know that we have been putting together a number of sessions where we will be working through this. So, and as you say, this is particularly live topic. So we'll take that away as an action just to ensure we've got a date.
Sheena.
Yes, it's not a comment necessarily for this section, but I think it's more general in the papers. I think it's inevitable that we've inherited a lot of functions, that we've got to put some certain things in place because of our statutory duties, etc. But the ICB, I think what came across very strongly for me when we were all introducing ourselves was a real sense of something new and an opportunity to do something different. And also the ICBs, I think, in terms of certainly the sort of central papers have been very strongly about health inequalities. And yet and I think for very good reasons, we don't have a particular committee on health inequalities, and nor on digital transformation. So it was really just a query about how we can make sure that those really important areas are surfaced. Is it that we make them standing items on every single board meeting that we have, or how can we actually ensure that these areas don't sort of slip under the radar as we focus on things that we are statutorily obliged to do?
I think that's a very helpful point, Sheena. As I say, today is the sort of the signing off bit, and as we go forward, I think keen to sort of co-produce almost the best way of using our time together as a board. Obviously, there will be some statutory things that we need to bring, but I think your point is well made about keeping sight of the health inequalities and digital. And I also think we have got some work to do in the next sort of 3 to 6 to 9 months as part of the refresh of our joint long-term plan, and as Nigel indicated, about how we sort of also distill some of our priorities. And I know that through previous discussions, that's been a key focus. Core plus 5, core 20 plus 5. It almost provides some of the blueprint for us. So we'll certainly take that away in terms of how we construct the agendas for our meetings going forward. But I think it also reflects we need to do some of that work in terms of working together, not just here as an ICB, but actually also with our One Devon partnership to co-create that. So, yeah, thank you.
Thank you. We're very grateful to you, Sheena, for joining the board and bringing your expertise in population and health management, public health and inequalities. And we know that you're going to be holding us to account to make sure that these issues are prioritised. But this is a starting point. It isn't the end point. We'll be able to adapt and change as we go. So thank you very much for raising that. Were there any other comments from colleagues here today? No? So we're going to come to the next item on the agenda, which is taking questions from the public. And do we have no questions from the public? So, but we very much welcome questions in future, and so do feel free to send them in to us. So we've now completed all the formal questions on this agenda, all the formal items on this agenda. And as I've said, this has necessarily felt rather technical and dry today in order to get us established and up and running. But we hope that in future, and certainly for our next meeting on the 20th, that there'll be a much greater focus on the state of where we are, our plans, how we're developing them, and how we're going to make sure that they're put into action. And it just remains for me to say thank you very much, all of you, for being here today, joining the board, and to all of you who are watching from outside. And thank you again.
Andrew, are we supposed to leave?